Okay, so I'm going to talk about radiation monitoring devices. So they're called dosimetry badges or dosimeters. So this is mine. They're labeled in our clinic with everybody's names on them. Um, they work to measure exposure to radiation by trapping freed electrons. And we obtain readings from this. My practice manager can plug this into her computer and obtain all of our readings quarterly and annually. It should be worn at all times, anytime you're exposed to X-ray radiation, and it should be worn on your thyroid collar. The MPD for veterinary staff annually is 5 rems or 5,000 millirems. And so I do have an example of our radiation summary report that my practice manager can pull up. So this is mine, and since I am currently pregnant, and I have been pregnant for this entire year, the year-to-date radiation exposure I have is 0 because I have not been taking any x-rays. One of my coworkers named Jessica, so her radiation exposure year-to-date is 38 millirems. So she is under the annual limit that veterinary associates can be under. So, but yeah, that's about radiation monitoring devices. Okay, so now I'm going to discuss personal protective equipment. So here we have all of our personal protective equipment in our clinic. So when I'm getting prepared to take an x-ray, I always put my lead apron on first. And with this, I'm just making sure that there's no any cuts in the lead, nothing obvious. We also do x-ray or lead aprons to make sure that there's no cracks in the lead. And when you're storing a lead apron, you're wanting to make sure that they are always up like this. You're not wanting to leave them crinkled up on the x-ray table because it can cause cracks in the lead. So I put it on like this. It fits around my body like this. This is my thyroid collar. It's nice that these ones have it attached. And then I just put this on like this. I'm wanting to make sure that it covers my entire neck and thyroid region. And then it just goes in the back like this. And so it should look like this. Our dosimetry badges are right here. So I'm going to grab the one that has my name on it. And it goes on my thyroid collar like this. So yeah, that's that. And then we have our lead gloves here. With my dosimetry badge, I'm also wanting to make sure that it properly works. Making sure that it's not broken, hasn't been dropped recently, anything like that, so that it's able to accurately measure how much radiation I'm exposed to. So with the lead gloves, you can put them on like so. And with these, I'm also wanting to make sure that there's any rips in the fabric, anything unusual when I do my visual inspection. These also get x-rayed every so often to make sure that there's no cracks in the lead as well. So I'm going to go ahead and put those back. There are lead goggles available as well for personal protective equipment. My clinic does not have that. But when we do take x-rays, we do avert our eyes away to protect our vision. But yeah, that's personal protective equipment and how we use it. Okay, so now I'm going to discuss radiation safety. So I'm going to explain some methods of restraint first. So I have some out. So this is a tie for an endotracheal tube that we use for when we're inducing patients. But sometimes I will use these on legs and tie it down like that so that I'm able to pull the leg out and hold it. And then my fingers are out of the view even more. I can also do that with a leg rope. Same kind of concept. I also have some tape that we can use. This tape is really good for taping tails out of the way. Also taping if I'm doing a view of like the metacarpals, I can tape them out as well. Then I have a trough. I use the trough pretty much for every VD image. So I have a smaller one here and then a larger one up there. It just helps me keep my patients straight in an area. I think it's also more comfortable for my patients so they're not laying on the cold, hard x-ray table on their spine. So I think that it gives some comfort as well. This is a wedge, so I can put my patient's head or neck in here as well to keep it straight. So those are just some examples of some restraint that I can use. I also have a plexiglass board over there, which we use for birds to position them against it. So I'm also going to talk about physical protective barriers. So we always wear our personal protective equipment, but this wall right here is lead lined. So especially with me being pregnant, I do not take any x-rays, but if my team needs help, I can stand behind this wall and manually expose out here. And this is a physical protective barrier that we have. So distance and exposure time can be utilized as a safety measure as well. So distance, the intensity of the x-ray beam decreases as distance increases. So the farther I am away from an x-ray unit, whether that be this one or my portable dental machine, the radiation exposure decreases. Time also, so if I'm preventing having to retake the same image multiple times due to whatever issue that is, it also decreases radiation exposure. So I want to make sure that I'm properly setting my settings on my x-ray machine and I'm in the correct view that I need to be and everything, so that I don't have to take multiple takes. Also, no portion of any body part, whether that's hand, whatever, should be in my primary beam, even if I have lead gloves on. So with the lead gloves on, only 25% of the primary beam is decreased as it comes from the bottom. So I'm still getting 75% of the radiation. And then also non-essential personnel should not be in this x-ray suite with me. If they're not needed for an x-ray, they shouldn't be in here to prevent unnecessary exposure to radiation. I kind of already talked about this already, but we really try to make sure that we're obtaining a diagnostic image on the first exposure. This reduces radiation exposure to the patient that I have and also the staff due to having to take multiple takes. There are also restrictions on pregnant women and people under 18. So currently I am pregnant, so I'm experiencing these restrictions, but radiation exposure causes intracellular water to ionize. It results in the production of some toxic products that can damage cell components like DNA. So genetic damage can occur in future generations of a person that's continuously exposed to radiation exposure. So pregnant women and the growing fetus are susceptible to cell damage and death, especially in the first trimester. So my doctor did not recommend that I take any radiographs. And then people under the age of 18 are vulnerable due to their having an early exposure to radiation, which can impact their reproductive cells. It can also impact their tissues of their skin, their breasts, thyroid, and then especially bone growing centers. So that's why nobody under the age of 18 should be taking x-rays, and then pregnant women consulting with your doctor to see what you can do about your exposure to radiation. So yeah, that's a little bit about radiation safety. Okay, so we're going to take an image of our patient Astor's CRCD of her radius ulna. So I'm going to go ahead and insert her into our computer. Select my doctor and then start study. I'm going to go ahead and select my image I'm doing. Okay, we're going to come over here. We're going to go ahead and measure. Go ahead and measure her. I know, baby. 3. I'm going to go ahead and set up our machine. I know. And so all of our technique chart, KVP and MA are already programmed into this machine, so I don't need to change anything in it. So we're going to go ahead, and it's her right front leg. She does have a fracture, so we're just going to take an image and see if it's healed. And with this, I'll go ahead and put one of these This is just a tie for an endotracheal tube, so we'll use it to pull her foot out so our hands are out of the image. Okay, little one. So JK is going to go ahead and put her down for me. Go ahead. I'm going to go ahead and collimate in since she's a little kitten. Now I want to make sure I get all the way from her toes up to her elbow. Okay, and then JK is going to go ahead and hold her for me. I'm going to go around the corners since I can't expose myself to radiation. Are you good, JK? Yep. Okay, and then we're going to go ahead and expose. Shooting. Good girl. Well done. Well done. Okay. And so here's our image. I'm going to go ahead and label it. And then I'll go ahead and show the doctor this image, and then we'll send it off for consult for a radiographic consult as well. Okay, so we are going to do our sedated OFA VD of pelvis on my patient. So I'm going to put in my patient's information. He's already in our system, so I'm just going to click OK and make sure my doctor is correct. And then do start study. And I'm going to do pelvis. We're going to do VDs. And so now we're all set up in this system to go. Next, I'm going to come over here. Okay, so now I'm going to demonstrate how to do a VD thorax radiograph. So I'm going to put my patient information into the computer. And my correct doctor is selected. Go to exposure. We're going to do a thorax and a VD. And so that's set up. Okay, now I'm going to go ahead and measure him. Hold on, bud. Okay, looks like he's 14. Go ahead and turn this on. APR. We're doing thorax, canine BD, 14. All of my technique charts are already in there, so I don't have to worry about adjusting KVP or MA. And then I'll go ahead and help get him positioned. We are going to use a trough. Okay, good. Good job. It's okay. It's okay. It's all right, buddy. Hold on. You're okay, bud. Good job. Okay, and Ashley's just going to go ahead and hold his front end for me. It's okay, baby. There we go. I'm going to go ahead and lift him down in the trough a little bit. So I want to get from his thoracic inlet down to his first rib in his lumbar region. I'm going to go ahead and put these on his feet. So this is another restraint that we can use to keep other Ashley's hands out of the way. You just want to hold those. So there we go. Hold on, buddy. I'm going to calm me in a little bit. Out. There we go. Okay, and then I'm going to step around the barrier wall. Are you guys good?
Yep.
Okay. Shooting. Okay. And that image looks good, so I'm going to go ahead and rotate it. Take it in a little bit because there's some extra on that side. And I'm going to go ahead and label it. So yeah, and that's how we would do a thorax VD radiograph. Okay, so we are going to do our sedated OFA VD of pelvis on my patient. So I'm going to put in my patient's information. He's already in our system, so I'm just going to click OK and make sure my doctor is correct. And then do start study. And I'm going to do pelvis. We're going to do VDs. And so now we're all set up in this system to go. Next, I'm going to come over here. Okay, so now we're going to measure his pelvis. Let's see where we're at. So we're at 22. I'm going to turn on my X-ray machine. With APR, pelvis, doing a canine VD. And then all of my settings are already in the X-ray computer or the X-ray machine, so I don't have to worry about messing with the KVP or anything like that. And this patient is on dexdomitor, so that's what he's sedated with. So Kristen's just checking his heart rate. Today we're going to use a trough to get him positioned on his back. Trough a little bit so I can see his pelvis. You got him? Yeah. Okay. Oh. Oops. So next, I'm going to position my light where I need it. We're going to have to pull him up a little bit more. I think we're going to have to pull him out of the trough a little bit more too. There we go. There we go. That'll be perfect. Okay, so next I'm going to palmate. So I want to get the top of his ilium all the way down to below his stifles. Looks like we're good right about there. And Kristen's going to set up our pulse ox monitor. Okay, and with this, not reading well. I'm going to position his legs. So I'm going to pull straight and rotate in, so that his patellas are in line straight. And I want everything to be straight. So as soon as Kristen's done taking his heart rate, I'm going to have her take over from me so I can step behind the boundary. I might need this a little bit. No, his patellas are all the way in there. He is a big boy. And then I'll go around the lead barrier wall and expose it. Okay, you ready? Shooting.
I think its knees aren't in it all the way. I think we need to take, oh no, the top of his pelvis isn't so, oh sorry, I'm talking when you're shooting.
That's okay.
So I think we just have to push it just a touch up, not a bunch.
Okay.
That makes sense. So you just a touch forward. There. Otherwise you might not need to squeeze in it. Yeah.
There we go. Okay, we're gonna expose again. Shooting. Okay, there we go. So I got 2 views. So I'm gonna go ahead and rotate both images and label them. Okay, and then I'll have the doctor go ahead and look at these images, and then we'll send off the radiologist, or for a radiologist report as well. Okay, so now I'm going to demonstrate how I can retrieve a patient's images from our digital database. So I click database in our program, and then I can search by the owner's last name, and then this is these are my patient's images. And so the doctor can go through here and look at any images. We can also zoom in, change brightness, anything like that. So yeah, that's how I'm able to retrieve images we had taken previously in our system. Okay, so we have our patient Rose here. We're going to do a contrast barium study on her. So we're going to do her survey images first to make sure that my settings and positioning is all correct. So we're going to start with a lateral. Come here, go on. Come on. Here, okay. Good girl. Rose. Stop. You're fine. Good girl. Okay. You want to grab her front end for me?
Good girl, Rose.
I'm going to go ahead and call me in. We're going to have to do, I'm going to go down a little bit more. Okay. I'm going to go ahead and step around. There, here. You guys good?
Yep.
Shooting. Okay. So it looks like that positioning is good. So next we're going to go ahead and administer some barium to her. Honey, you're not helping. Rose, come on.
Good girl.
Good job, baby girl. And since I'm using a powder barium that's reconstituted, I'm wanting to make sure that she's not aspirating anything.
Good girl.
Oops. Come on, just a little bit more. You can do it. There we go. Good girl. Okay. Clean her up a little bit. I know, I'm sorry. It doesn't taste very good. Okay. So next we're going to get her on her side again. We're going to take a lateral and a VD image, and that we're going to count as time 1. And then I'm going to do lateral and VD at time 15, 30, and then 60 minutes, and then every hour until I see the barium, until the barium reaches her distal small intestine. So we're going to go ahead and position her laterally. It's okay. You're okay. It's okay. It's okay. It's okay. Rob, you're fine. I'll have Ashley go ahead and take over her front end for me. Keeling's just holding her back leg straight. Okay, I should be pulling it in good enough. So I'm going to step around the barrier. Shooting. Okay, and then we'll go ahead and do your VD image. I'm going to grab one of our troughs. It's okay. Rose. We'll go ahead. It's okay. Roll. Flip her onto her base. Good girl. Very good girl. Hey, you're fine. Ashley's going to go ahead and take her head from me and her front legs. Just wanted to get her as straight as possible. You're okay. Okay, I'm going to step around the corner and go ahead and expose. Shooting. I know, baby. I know. It's okay. Okay, so there's our VD image. Okay, and then we'll go ahead and wait 15 minutes, and then we'll go ahead and do both those images again. Okay, so now we're going to do our 15-minute views for our barium contrast study. So we're going to go ahead and take her lateral image first. So we're going to go ahead and get her on her side. It's okay, bro. It's okay. It's like I don't want to get my side. I'm sorry. In the same positioning. It's okay. I'm going to have Ashley go ahead and take over her front end for me. Kayleen again, just holding her back legs. Okay, and then I'm going to go ahead and step around the barrier. And expose, shooting. I know, good girl. Okay, and that's our second lateral. And then we'll go ahead and get her in the trough. Rose, hey, Rose. I know, Rose. A little bit. You're being such a good girl. Ashley again is just gonna hold her front end for me. Making sure she's straight in the trough still. Okay, I'm gonna go around the barrier and expose again. Shooting. She's like, I'm so okay, and that's our second image. So then I'll go ahead and continue doing the rest of my views, and then we'll show the doctor and then send off for a consult with the radiograph radiologist.
Hi, my name is Kayleen Windsor. I'm a licensed veterinary technician in Washington, and I'm Brandy's preceptor. She has really excelled in radiology these past few months. She's really good at having proper technique and collimation, as well as positioning the patient correctly. As far as weaknesses, Brandy can sometimes take a bit too long to position the patient, and she's a bit of a perfectionist, so sometimes too many images can be taken. Brandy has really progressed since being in this class. She has a great understanding of anatomy and terminology, and has really honed down her technique and proper positioning. I feel like Brandy has a great understanding of radiology now.